First of all, good morning, good afternoon, good evening to everyone who's joining from around the globe, and welcome to this evaluation practice exchange, which is being organized by the COVID-19 Working Group of the United Nations Evaluation Group. So I want to introduce myself quickly. My name is Mona Fatou. I'm the Chief of Evaluation for UNICEF Ukraine, and I'm also the co-coordinator of this working group, along with Carlos Tarazona from FAO, who's also on the line. I don't know if you want to put your video on and say hi, Carlos. So today our EPE is going to be on reaching the most vulnerable. What did we learn from the COVID-19 pandemic? And just as a quick introduction to the working group itself, so the UNEG COVID-19 working group started in 2020, as you may imagine, with the aim to have a coordinated UN evaluation agenda around COVID-19 in partnership with other networks. And we're among those partners are the COVID-19 Global Evaluation Coalition under OECD DAC and ALNAP, and I think we may have some participants from each of those with us today. The group also works to ensure that we capitalize on the lessons learned in evaluation practice in the COVID context and these new ways of working. And in that way, the topic of this EPE is really relevant. That's a question that's been emerging as we've been turning to greater use of remote methods, and how do we ensure that we continue to reach the most vulnerable groups who may not, for example, have access to digital data collection mechanisms? How do we ensure that they're still an integral part of our evaluations? So I wanted to thank our organizing committee first. We've got Emilia and Angelo from FAO, Elisabetta from UNAIDS, and Lilia from OIOS. And we also wanted to, they really put a lot of work into putting this together, so thanks so much to them. We also wanted to appreciate the suggestions and contributions of some of our partners, including Susanna from ALNAP, Ian and Eleanor from the South African M&E Association, and Taruna Gupta and Linda Raftery. They all helped us identify speakers and the approach of the agenda and workshop. So as you can see here, we have a packed agenda today, and we have two really excellent presentations and speakers. I will get into the agenda format. So we're going to have our two speakers present. I'll introduce each of them. They're Jerusha Govender and Uyen Kim Huen. There'll be a short question and answer period after the second presentation, although we may do a short Q&A after each. We'll see how things go. And then we want to have the opportunity for breakout room discussions, and that's really getting to the evaluation practice exchange purpose of these sessions, because we want to be able to learn from each other and have a chance to exchange and then present back. So that's the plan for the day. I think we can just jump right into our first presentation. Again, please feel free to introduce yourself as well in the chat box, your name and organization and where you're from. I think it's always fun to see the global nature of the participation in these EPE sessions. So I wanted to introduce our first speaker. It's going to be an incredibly fascinating bit of work that she's presenting, so we're really happy to have her. So Jerusha Govender is a monitoring and evaluation specialist, information designer, and entrepreneur with 15 years of experience in evaluation and data innovation. In 2015, she founded Data Innovator, leading projects across Africa, North America, and Europe for over 50 organizations. And this has since grown into the Data Innovators Group with the introduction of new partners and an expansion. Jerusha has served on the South African M&E Association Board, on the Merle Tech Josie Steering Committee, and Responsible Data in M&E in Africa Working Group. She holds a Master's of Public Health from the University of Cape Town, as well as a Master's in Public and Development Management from the University of Witwatersrand. I hope I said that right. So welcome, Jerusha. We're very happy to have you, and I'm turning it over to you. Thank you.
Thank you very much for the intro, and thank you for having me as part of the session to share some of our experiences and lessons with you. So yes, I'm really going to talk you through a specific case of work that we've done in South Africa, and also share some examples of other cases that might be relevant as you think about innovative and alternative ways of incorporating into your evaluation practice, particularly in settings or contexts such as the one we've just experienced with COVID-19. And the topic that I'm specifically speaking to is around a multi-channel kind of communication and innovative approaches that we've used in gathering data during the pandemic. And you've already heard a bit about me, but just quickly to share who Data Innovators is. And as we've shared, it's a social enterprise that has really morphed from its beginnings in 2015. And all of our work is what we talk about is helping organizations push data boundaries for positive futures, which means that all of our work is looking at how we support development entities, including NGOs, funders, and other development agencies, to really think differently about how we use data and incorporate evaluation practice and innovative methods. And so we do work that looks at using digital data solutions, at M&E advisory services, capability building, as well as implementing projects where there's a data usage focus in it. And so some of the work that I'm sharing now really comes from both our digital data solutions work as well as us supporting project implementation. And so just introducing you to why I'm talking about the specific case. So as you all are very aware that during COVID-19, there were various restrictions that were posed, challenges and restrictions due to these kind of challenges that affected how we could collect any kind of data for either evaluation practice, research and management, and even considerations for the safety of our team members and those that we were sourcing data from. Some of this is related to challenges speaking to the limits on gathering. And so not being able to really gather groups where we were maybe facilitating kind of discussions or other ways of collecting qualitative data collection. There was also the closure of non-essential services. So even ourselves and the organizations we're working with were not operating in the norm at all. And then there's also the reduced income that has affected either evaluators, evaluants, and individuals, which meant that even the kind of the budgetary requirements for what we would usually invest in was then shifted, that we needed to think of other ways to spend when it came to data collection mechanisms or tools. And so in this presentation, really, I'm sharing with you a case that is about how we've adapted in this context. And it speaks specifically to a data collection case where we were working with a marginalized group or kind of marginalized population rather in the ECD or early childhood development sector. And I'll also share a few other examples and tools that you could consider using in similar contexts. So just to share a bit of background to the project that I'm referring to. So as I mentioned, it's specifically a project that is set in the ECD sector, and it was a project that was supporting the implementation of an ECD relief fund. And so we do know that the ECD sector is really a key sector, particularly in South Africa, where we're investing, that we know will support the longer term education outcomes, skills and capability development of young people in the country. And this is similar, of course, across other countries as well. However, the ECD sector or the ECD practitioners were largely affected because during lockdown in South Africa, ECD centers were closed. And so even though the ECD sector or the education entities such as schools, there was a point where they were open because they were based under the Department of Basic Education. Not all ECD centers were opened yet. And so this had a major effect on the ability to sustain the employees, as well as to provide a space for young people or for children that were learning. And as a result, this is where the relief fund really came in, and we are supporting the implementation of this relief fund. So in 2020, the South African government launched the Presidential Employment Stimulus Relief Fund to support sectors such as the ECD sector and others that were really affected by the closure of the entities that were employing them, and made available 496 million Rand, which is around 20 million USD funds available to disperse to these ECD services. But in order to disperse it, there was an application process, and there was kind of a data gathering process that needed to happen, because the ECD sector in South Africa is a mix of formal and informal entities. And so it meant actually going out and identify who are these entities or who are these individuals, because it's a mix of mobile early childhood development services, individual practitioners, actual established centers. And in some cases, it's what it may be a gogo, which is a grandmother, that is really just supporting a small kind of group of young people in a very, very rural area. And so the application process needed to reach these individuals and access data so that we could understand how many staff were employed, what were some of the barriers or the challenges that they were experiencing, so that the funds could be dispersed to them. And so through the process, there was over 27,000 applicants, which also accounted for more than 100,000 ECD practitioners or staff that could access this funds. And our role was then really to support this initiative by accessing their data, analyzing it and identifying what are some of the gaps and their challenges, but also then supporting in the verification process and ensuring that where there were individuals that couldn't actually submit information on the application portal, that we were then supporting in that gathering and ensuring that the data that they were providing was appropriate as well. Ultimately, just making sure that the implementation was efficient and also fair in the disbursement of the funds. But some of the challenges we experienced were quite vast. And I mean, if we imagine, any kind of development country context, we know that internet access is quite sparse, and expecting an ECD practitioner to submit an application on a platform meant that they were definitely restricted, and that we would not access that individual's data without looking at other mechanisms of supporting them. We also know that, or found that, mobile access was quite restrictive as well. In the application process, because you were submitting personal information, there were built-in steps for verification where you'd have a code sent to your cell phone. However, many people were using the cell phone of their child or a neighbor. And so in order to update information, sometimes you were not able to do that because you didn't access the mobile phone that you were using for the application process. There were also challenges around computer literacy because it was an online data collection form. And in some cases, also tracking ECD practitioners that had to close down. So those that were still eligible for funds no longer were operating, but we needed to identify where they were. In some contexts, there were challenges around buy-in from stakeholders. So the ECD sector is quite closely knit, and there are various kind of communities of practice within within provinces or communities. And sometimes requesting data from them was met with kind of, with a lot of pushback, because we needed to ensure that, in fact, community members knew why they were applying through this process, why were they gathering, why did we need this data? And then there were other things such as the rural location of the ECDs, the awareness of the actual process of data gathering, language, and as well as backup records that we needed. So the approach that we took then to support this data gathering exercise and analyzing the data was really multifaceted. And so we knew that the single way of deploying a mobile data collection or even the web-based data collection platform was not enough. That in order to make sure that we reached every ECD practitioner and every ECD service meant that we needed to find multiple channels for doing that. And so I'll just talk through some of the channels that we then used. So firstly, we put in place a call center. So we knew at least that those that did not have a smartphone, or where we did have contact information, we could reach through a call center and really talk through and have access to the application process and complete it for them. And we ensured that those people that were in the call center could speak all of the South African languages. We have 11 official languages, so that when they came across an individual that spoke a certain language, either you were referred to one of the call center agents that spoke that language, or you could be supported immediately. And then in cases where there was not even mobile coverage, we set up help desks. So really the help desk was a space where you could come in person, and we sent out notifications via SMS and WhatsApp to say, today on Monday to Friday on this date, there'll be somebody that can assist you. And that person had mobile access and others, and would then support an individual in capturing the information for them. Then thirdly, there were site visits. So in cases where we really could not track an ECD, so using the data, we couldn't track them, we couldn't contact them, there were physical visits to those specific selected sites to ensure that we could verify them and support in data gathering. There was SMS communication to guide on how to capture information if they could do it themselves, as well as a WhatsApp bot to provide kind of queries or if you needed support, these were then also channeled to the call center who could then contact you on that specific number. And then lastly, there's the database integration. So we looked at what were alternative data sources that were available that we could integrate without having to ask you about the details of your ECD service, whether existing sources such as the National Department of Social Development had registration of certain ECDs. And so that allowed us to kind of streamline and not request information that was already existing. Ultimately, all of this was aggregated then into a central database that was used to support the disbursement of funds. Just to share a couple of images of what this looks like. So in the top left corner is what one of the help desks looks like. So it was really an individual, and we had a collaboration with a couple of stakeholders such as department, local offices, or even with certain ECD centers where they allowed us to use their space and then kind of be there for a period. And they also helped in mobilizing through the community to invite the ECD practitioners and others to the space. And then it's also just an image of what one of the posts looked like and the WhatsApp bot where you could pose questions and get a certain response. And then we use that data to channel to the call center as well. And in terms of the key lessons that emerged from this, I think there were three major things that really stood out for us that is relevant to evaluation practice, research, and any kind of data gathering and analysis in this type of context. Is firstly that in order to reach marginalized and vulnerable population, it really requires that we go multi-channel or multiple ways, which also needs to consider not just the high-tech approach, but what are the low-tech and the high-tech ways of reaching. So such as the help desk, which was really, in this context, we physically need to find a space. It is the only way we're going to reach them. Secondly, is that the role of stakeholders and community leaders is really critical in reaching these groups, because often marginalized or vulnerable groups, these are the individuals that they trust. And so when we needed to access data or information from them, it was important that we went via the community leaders. And then it also meant that those community leaders supported us in getting spaces or mobilizing and identifying ECD practitioners that maybe we had them on our database, but we actually couldn't find them. So they played a role in identifying them as well. And then lastly, that communication is also quite important. As much as our goal was to gather data and support, but it was very key for us to share many forms of communication explaining why we're doing this, why it's useful, what are the ethical considerations, what are the, so that there was a trust built and there was a very transparent picture of where the data, or what the data was going to be used for and what the output. So we even did kind of frequent briefing sessions with various communities in person, or we had kind of virtual Teams-based ones where others could join. And then lastly, what I've shared is just kind of a couple of ways one could use kind of this multi-channel way of data gathering and getting buy-in and communication. These are just a few other approaches one could consider, which are both low and emerging tech. And the first is looking at how you could possibly use radio. So in Africa, we know that radio is more accessible than mobile coverage, in fact. And there is a kind of growth or there's a goal to expand how radio is used, particularly community radio. And the Children's Radio Foundation is just one example of an organization that really uses it more for engagement and awareness purposes. But the opportunity there is that from a kind of discussion approach, one could use radio as a way to disperse insights, but also to kind of get individuals either involved in a data collection process, if that is what you're aiming to create awareness of it, and also others that can actually phone in and discuss via radio. And then secondly, my kids are making a lot of noise in the background, apologies. And then there's also interactive voice response, which is also quite useful in context where, individuals don't have access to smartphones, but there's adequate mobile coverage. And in this case, it's really doing kind of telephonic-based surveys where you can gather data in this mean. At the bottom left is an image of a kind of this is I shared this in a recent conference as well, but this is a picture, an aerial photography image, which gives you a visual kind of picture of disparity between two communities. The one is a golf course and the other side is a township. And this is from a project called Unequal Scenes. But there are similar initiatives that allow, or approaches in using aerial photography that could allow using visual data on either land or changes in space, in urban spaces, just as an example. And then lastly, another a good use case is the use of WhatsApp discussions. So Shujaz is also an African-based organization, and they use WhatsApp discussion and even using the emojis as a way to facilitate a focus group discussion via WhatsApp and allowing young people to engage on topics that might be quite difficult to verbalize, but can use the emojis and other ways of sharing media to discuss and share insights. So those are the cases that I'd wanted to share. And yeah, thank you. I'll leave you at this point. I'll leave it at this point.
Thanks so much, Shirisha. I think it's an amazing example of really a concerted effort to ensure that voices of communities are included in more than one way, and in tailoring those methods to the context in which you're working, and also closing that feedback loop. I think that's something we in UNEG could probably have a separate EPE on. But I wanted to open the floor up to questions. We are waiting for our second presenter. She's coming from another commitment, actually, which I will announce once she does come. But we do have a few minutes for questions, so please either go ahead and type in the chat, or you can raise your hand and ask it verbally.
Hi, everyone. Really an interesting presentation. Thanks so much. I think when we look at the COVID response, one of the questions that comes to mind is, we were forced to adopt rather extraordinary measures during the pandemic, or at the peak of the pandemic. But some of those things maybe should become the new norm. And some of those things, maybe we need to go back. So if I give you an example, UNHCR, the lessons learned for us is that GBV services really do need to be delivered face-to-face because of the sensitivity of the issues, confidentiality, many reasons. On the other hand, refugee registration using apps on phones and facial recognition worked pretty well and could potentially become the new norm with, as your presentation rightly pointed out, always the need to have an alternative to virtual services for those who, for whatever reason, don't find it easy to access it. And I think a key question that came up in that is cost. Are we thinking about the cost effectiveness of using these remote methods? So what are they effective for reaching communities in pandemic or non-pandemic situations? And what is the comparative cost of using those approaches compared to maybe some of our more traditional approaches? So back to you, a very interesting presentation. Thanks.
That's a good question. And I think in the context that I shared, we did not do that comparison really. And I think it's something that would be important. In our context, it was because it was a relief fund. There was a lot more, we could take a lot more risk somewhat around budget or push, because we needed to make sure everyone was reached, no matter what, like whatever, find the approach and we will support you as long as you can justify it. So in this context, because the goal was like ensure that we have identified and access the info for every ECD practitioner, there was not the point of like stopping and looking and we had to move quite quickly as well, because the funds needed to be dispersed in a certain period. And I think in some cases we did find that even the help desk, even though there was a travel cost that we needed to account for, that it is actually it is expensive for us to deploy people to quite rural locations, because we have to think about flight plus and other things. But in fact, the benefit was that we were reaching those individuals that when we, as much as we reduce cost in sending out perhaps like SMSs and creating a platform to streamline it, there was kind of that we would not have that benefit of the reach. And so as much as we didn't do that cost benefit analysis, that's kind of a key thing that stood out for us, and a difference that we had the room to move without the budget constraint.
So I see that Uyen has managed to join us, which is great. I think we will move on then to her presentation, and then we'll have a chance for participants to ask questions of both of our presenters afterwards. So first, I just wanted to give a brief introduction. So Nguyen Kim Huynh is an evaluation specialist with the evaluation office at UNICEF headquarters in New York. And in this role, she advises on approaches to advance the scientific rigor, learning, and use of UNICEF's evaluative work. Prior to joining UNICEF in this role, she was Assistant Director of Policy at the Center for Globalization and Sustainable Development at Columbia University, where she was focused on policy development in sub-Saharan Africa. Nguyen has extensive experience in designing and implementing impact evaluations in low-income countries, as well as on refugee health and health systems. She has a PhD from Harvard's Program of Refugee Studies and a master's in public administration from Cornell University and public and economic policy. And the reason that she joined us a little bit late is a piece of work she was presenting was a finalist for UNICEF's Best of Research award. So congratulations on that. And I will turn it over to you. Thank you.
Thank you, everyone. And I'm sorry I'm joining late, but thank you for that welcome. Mona has already introduced me, but I'm the innovation specialist and I work in a section called Methods, Impact, Innovation, and Learning within the Office of Evaluation. I'm very honored to be part of this panel series. During COVID, I'm going to talk about a piece of research that I put together and walk you through how it was implemented and the types of impact it had and also its relevance to evaluation. It's called the Community Rapid Assessment using mobile phones to monitor social and behavioral data during the COVID-19 pandemic. It was a project that was conducted in 2 regions across 12 countries and it's later scaled to 3 regions. The overall objective of this presentation is not so much on the findings themselves, because as you can imagine, the findings aggregated over 12 countries is quite hard to put together in a short panel, but more of an emphasis on the methodology that was developed. A large part of my work in the evaluation office is to pilot, test, and adapt new methods and data advancements to boost rigor in our evaluation findings. So in March 2020, when the pandemic was declared, we remember the massive disruptions that affected all aspects of our lives. And for evaluators, it really required us to think about how to do our work differently as global lockdown measures forced remote methods. So this gave me a chance to conceptualize evaluation methodologies so that they could be more agile and responsive. And moreover, the UNICEF management and executive board really encouraged different kinds of evaluative work to study and observe the effects of COVID-19 on communities so that findings could help improve program implementation and adaptive management. So in this sense, I began to think of a methodology that could best enhance the utility but to do so rapidly. The question I asked myself is, what methods could be derived that would produce findings which would be good enough given the global emergency that was unfolding? The pandemic also allowed me the opportunity to fully conceptualize a multi-country and multi-region real-time methodology. And the principles of this method had to be anchored on a few core pillars. The first is that it had to meet the evidence needs of the country. The second is that the assessment had to be implemented very quickly. And the third is I wanted to have real-time analysis between rounds. So data findings produced almost in real time, if you will. And I wanted to do this as cost effectively as possible, given that I didn't have much of a budget. So the average cost per country across 12 countries was about $32,000 for 3 rounds of data analysis and a visualized real-time dashboard. So in my needs assessment, I realized that there was really a need for more precise information about how people were behaving and coping with the pandemic, especially in the context of a quite fast-changing disease landscape that went beyond global health threats, but also had socioeconomic related impacts. There was also a need to have more scientifically robust population-based data that could be collected, analyzed, and delivered to country programs in a timely manner. I was really interested in promoting a more systematic and standardized approach in which I could gather time series cross-sectional data to be analyzed for national and regional aggregation. So in short, my goal was to provide rapid and real-time community source findings from time series data for country programming. I launched the CRA, the Community Rapid Assessment, in May of 2020, a couple of months after the pandemic was declared. And some of the longer-term objectives were to see whether we can adapt mobile phone data to prepare us for future emergencies. prior to the pandemic, mobile phones were data were collected typically for polling services, but we examined whether or not we could use mobile phones in some countries with higher mobile phone penetration in order to gather a solid enough denominator so that we could apply post stratification weights to make it as representative as possible. I also wanted to demonstrate that the lightweight and cost-effective approach that we hear so much about could be used in other sectors and scaled in a standardized way. So based on the literature I reviewed, I started to believe that we should be routinely integrating social and behavioral data and understanding the organization's effectiveness and relevance, and that these data should be more prominent in our own evaluation designs, especially targeting vulnerable groups and affected populations. I think it's important to understand what the community CRA could answer and did not answer. I anchored this body of work into a theoretical construct called the behavioral drivers model, which I'll talk about later. It wasn't designed to be an RCT or any determined causal inference. There were no comparators or control groups in the 12 countries where we implemented it. And it wasn't necessarily designed to be a piece of the primary data source for any evaluation. We see that since the pandemic has in the past couple of years, the pandemic has really launched mobile phone data sources as being more rigorous than it ever has been. However, it has not yet been proven to be a standalone data source. The CRA really was intended to provide social and behavioral insights to inform COVID-19 related policy and program decisions. And as time series data and cross-sectional, I chose not to proceed with a panel model because we weren't clear on how long the pandemic would last and whether or not how further the disruptions would be, and collecting panel data seemed to be more costly and perhaps more complicated given the uncertainty of what was going to happen. But it was intended to provide individual level data that examines country and specific regional trends over time because of the standardization of the modules. So I joined UNICEF in 2019, I think, from academia, and I was relatively new to the organization and to the UN in general when I conceptualized this, only about 13 months or so before there were global lockdown measures put in place. So I really had to navigate the organization without knowing a lot of people, but was fairly disciplined in shopping the concept around to regions. I was the chief of my own section, but as I said before, I had a pretty small budget. And so I had to seek partnerships and co-financing to get this thing out. I went back to Harvard and asked for support, and I received it through the Harvard Humanitarian Initiative. Their role was to peer review our survey design, develop our weight models, sampling estimates, and peer review our data analysis. This work was really done in-house. I had a data scientist as a consultant, and myself, I had a couple of interns. So HHI, their role was really to make sure that what we were doing ourselves really held water. So they would look at our analysis for each country between rounds to make sure it was accurate. They also provided a dashboard of real-time indicators country by country. And they all did this pro bono. I also wanted to engage more deeper analysis on this project. Since I didn't have the capacity within my own section to have more analysts, I reached out to Statistics Without Borders, who were able to provide excellent correlation analysis in a few SAR countries, the East and Southern Africa region countries. So between Harvard, Statistics Without Borders, and UNICEF, we published several papers actually and conferenced our findings more recently at the European Evaluation Society conference this past summer. So this is a theoretical construct that I mentioned earlier called the behavior drivers model. It was written by researchers within or program specialists within the social and behavioral change section at UNICEF. It served as a core construct from which the SBC group, the social behavior change group, has developed their program strategies. We designed short modules to test certain but not all hypothesized pathways. One being on information, communication, and trust. The second module focused on behaviors on prevention and protection against COVID-19, and another one being on coping strategies and emerging needs. We did offer supplementary modules. However, these were specific to countries and their needs. One being vaccine uptake vaccine uptake and willingness for the vaccine once the vaccine entered the market. We broadly characterized the study in these main questions, but more specifically, we looked at questions such as, do the proportions of responses differ by age group, gender, country, education level? Do women tend to wear masks more than men? And if so, where? What are the combined effects and intra-factor correlations between different drivers? For example, do behavioral practices appear to be correlated? What is the risk perception that people are expressing during different phases of the pandemic? How have needs in the community changed over time? And as I mentioned earlier, what's the willingness to receive available vaccines when they enter the market? The methodology we used involved Viamo, an external data collection firm. We planned for 3 rounds of data, mainly to keep costs down and to see whether 3 data points could provide sufficient and useful information. Our sample size was targeted at 1,000 people per country in a repeated cross-sectional design using random digit dialing. The modality we used is called interactive voice recording, and the survey modules were translated in 3 local languages for each country. The entire survey was no more than 21 questions and included 4 demographic variables. We relied as much as we could on published survey results, but also allowed flexibility for countries to amend certain questions as needed as it pertained to their specific context. So as I said earlier, this was somewhat quickly conceptualized, put together, and I pitched it in a few regions. And part of the pitch was really making it demand-driven with a tripartite costing model. So 8 countries from ASAR asked for it, and I said the average budget envelope earlier was about $32,000 per country. So in ROSA, 4 countries participated in the CRA. They used standardized modules for the exercise, but in terms of sampling strategy, each country had to adapt to existing feasible databases. I won't go too deep into this, and I have some related findings, but perhaps with a lack of time, with a short period of time, let me just go through the next slides quickly. So the principles we applied to our analytical model were that we wanted real-time analysis between each of the rounds, and we wanted to use a post-stratification weight model to make it as the results as representative to the national population. So in terms of our model hypothesis, we expected the distribution of the proportion of respondents across selected elements of the BDM, the behavioral drivers model, to change over time. We provided descriptive statistics disaggregated by the demographic variables. And then in some countries, we ran correlational analysis, but we realized that very quickly people were they felt that they had enough information just by delivering real-time analysis of our sort of primary research questions. Let's go to the next question. Next slide, please. Let me just show you some of the data so that you get an understanding of what kinds of visualizations, what kinds of trends we saw. So in ROSA, we saw that risk perception decreased over time in Nepal, but stayed fairly constant in Pakistan and Afghanistan. In India, the risk perception was the lowest in 4 countries, with only 22% of people responding they felt any risk at getting COVID and becoming very ill. So here you see in East and Southern Africa, between 2 countries, South Sudan expressing much more risk than becoming sick with COVID. And interestingly, in Kenya, the risk perception, while it was not directly asked, we can see that that the issues of most concern for families with children was falling sick with COVID. Second to becoming sick, parents expressed some concern with their children being involved in some dangerous activity. We aggregated wherever we could on standardized questions. And this, I think, was probably one of the most compelling pieces of our work, is the aggregation of multiple countries and looking at the concerns. We did look at differences between countries, but we see in this aggregation, social isolation was among the greatest concern, followed by losing their job or income during the pandemic. And then in terms of information sources, you remember in the early phase of the pandemic, there was a lot of media campaign about demystifying the pandemic and a lot of misinformation that was spreading across the world, actually. So we looked at information sources by demographic variable, and we see that in South Sudan, community mobilizers have actually been more relied on for information than government or family or friends. So local community trusted groups actually became sort of the immediate mouthpiece for people to get information. By contrast, Madagascar, there seems to be some significant differences in the role of TV and radio. We see in this vaccine willingness, there is a large proportion of the respondents who said they'd be willing to take the vaccine if offered. But interestingly, it's not depicted here, but the age band of 44 and older had the lowest level of willingness to accept the vaccine at 72%. So this is the absolute last slide. So this exercise allowed us to look at community level changes, paying specific attention to behaviors that reacted to a very fluid and disruptive global health emergency. Behavioral insights have been instrumental in understanding how interventions work and how they could be better iterated, not only during a pandemic, but just in general terms. So often we see that CAP surveys provide a quick dipstick measure. However, it's not until we understand it in a more trend analysis, time series, or longitudinal that we could look at behaviors over time and see and make some predictions. Also, we found that rapid analysis between rounds was particularly useful rather than wait for all the data to come and analyze it at the end. We found that the real-time dashboard that Harvard produced also was very well utilized and often referenced to inform social behavioral change strategies, including RCCE. The standardization of data also proved to be useful from the regional context as I said earlier, look at differences between countries on the same indicators. I think lastly, and most importantly, scalable methods don't have to cost a lot of money, and often they don't. We can do this and yield very solid evidence on justifiable findings, not needing to spend an enormous amount of money. So I think that's the last slide. I want to thank everybody for paying attention to my findings. If there are a lot more slides that I can share on the actual findings if people are interested. Thanks so much.
Thank you so much, Anne. I know there's a lot of rich information there, so we'll be sure to share your presentation with the participants after the webinar. So I want to turn it over to Amelia, who will moderate a Q&A period. We have just a few minutes for a couple of questions before we go into breakout rooms. So over to you, Amelia.
Thank you. Thank you, Mona. Thank you, Oyen, for the great presentation. Also, thank you, Jerusha. We have 3 questions on the chat. If maybe people want to open their cameras and ask their questions. We have questions by Laurie, Olivia, and Elisabetta.
Okay, thank you. But it's a bit linked to your question, in fact. It's about the recruitment procedure. Maybe I continue yours as well. Like, was it... how were telephone survey participants identified and their role? I had the same question, basically. How would you identify? And then linked to it, how was these findings linking to UNICEF work? How were they used? Or since it was real time, how, if you have an example, if it happened or was the intention of how they improved UNICEF work? Thank you.
Thank you. I think your first question again was the recruitment of respondents. Is that right? Yeah. So Viamo, the phone company, and most countries have access to mobile phone operator network databases. So they used a sampling approach called random digit dialing. And it was all voluntary. So our sampling strategy was simple and then later stratified by province, depending on the country. When you pick up the phone, you're sort of randomly selected for the phone survey. You pick up the phone, and then there was an option to take the mobile phone survey or not. There's an informed consent at the beginning of it, within the introduction. We didn't survey anyone under 18 just to avoid any complications with ethics, but I didn't see, I think we probably could have
survey people between 15 and 18, but for the sake of just ethics, we wanted to just survey 18 and older. So the response rate varied between 11 and 40% for most countries. So we didn't have necessarily information on who held the phone. We had some phone numbers, prefixes that told us where the mobile phone subscriber lived. And so we tried to use that as one covariate to determine how much, what our sampling estimates were based on province, and then did sort of a simple random sample, and then weighted it by province with other variables such as age and gender. But that mobile phone surveys typically have this approach where they have a big, huge database and then they collect data. So you can see that there is a somewhat of a selection bias, because there's not everybody has access to a phone or owns a phone, right? So I mean, I've been looking at this, the robustness of mobile phone data and comparing it to household survey, and I think nothing is going to be as gold standard as a household survey, but there's more and more strategies to make mobile phone population-based data more representative, and especially in countries with 65 or higher % mobile phone penetration. In terms of use, the social behavior change section actually used this data quite a lot in their risk communication, and forgot what the other C stands for, strategies. So
Community engagement.
Community engagement, right, exactly. So they iterated their strategy based on a lot of these data within the country, quite a lot. The health section looked at it for immunization, especially on the vaccine uptake. There was more outreach to, as I said, like specific information groups, as informal, like the informal community groups. I would say that the concentration of the use has went into RCTE and some health and immunization in terms of just like looking at their program strategy again. At the end, methodologically, they really wanted to use this type of M&E data and to inform their overall sort of programming. I think before that, I didn't really realize it when I started this collaboration with them, but they were quite working in a desert of data. There was really not that much rigorous, representative population data that was informing their strategy. So overall, I think they sort of shifted towards looking at these kinds of data and bringing in an M&E component within their program in a more serious way.
Thank you, Ian. Olivia, over to you. Olivia has a question, and then after Ian's response, we're moving to breakout groups. So Olivia, please.
Yeah, thanks. I think actually you've answered my question by answering the previous one, because I think I'd assumed that we were targeting a certain group, and from that we sort of knew about their vulnerability. But if I understand correctly, it was more that you were, kind of random sampling, and then they were kind of representative of a wider group, which is still really useful data at that point in the pandemic. But maybe, you weren't targeting a specific group, so the dropout rate wasn't particularly an issue. So maybe I can ask a second question, if I could be cheeky. Did you ever consider elements of two-way communication? So some mobile phone was kind of repurposed to kind of use the monitoring as also a chance to kind of share risk information at the same time. So when they were asking questions, they were also, sharing some public health information. Did you consider that? Or was that just like making all of this really complicated?
Yeah, that's a very interesting aspect to this type of study. It would have been good to sort of elaborate that, but we didn't consider it. Mainly, we tried to mitigate as much as we could on selection bias by making it just a voice recording so that people could understand it in their local language and didn't have to read or type something back in any kind of local language. So we didn't do that. And we also, I think the CRA has been reiterated in SBC and being sort of scaled to other countries. So I think they're looking at different ways to collect richer data. In a compressed mobile phone survey, I guess you really can't get as much fed back to you. But I mean, just having sort of national, subnational aggregates and looking at who responded to the survey and who didn't respond to the survey. So we also tried to analyze the non-respondent data as well to see who are the people that are dropping out. So that data is, if you will, I mean, looked at as like, why aren't some people not, responding to a survey, and who are they, where do they live? So we haven't thought about the two-way.
Thanks a lot, Uyen. Thanks a lot, Olivia. So we are moving to breakout groups now. Our proposal is to hear from you experiences that you had or that you were aware of about reaching the most vulnerable during the COVID-19. The idea also is to reflect on experiences that we want to retain, that we want to keep for the future. We would like to hear from you so that we can share. We can have a sharing moment of the participants and collect those experiences for further exploring among the UNEG community. So you are going to be now randomly assigned to one of 4 breakout groups with moderation by Mona, Carlos, Lilia, and Elisabetta. And then we'll be back in around 15 minutes for reporting back and having a final discussion. Welcome back. I think most people are already back. Thanks a lot. I've been, sneaking into the rooms and saw very interesting discussions and, sharing of experiences. So we'll have a quick round of feedback from the groups to the plenary, and then hopefully also a little bit of time for the final sharing and questions. So Lilia, would you like to start, or the rapporteur from your group?
Mm-hmm. Thank you, Emilia. I will report on behalf of our group. Very briefly, we all agreed that it was extremely difficult to reach vulnerable groups. We had examples on reaching women, youth, persons with disabilities, children with disabilities, people in prisons, and so it was really impossible, as our group participants shared with us. But going forward, UNEG shared with us some ongoing work that they are thinking to try in Afghanistan, and the platform is called Premise. It's the idea is to hire local enumerators who are mostly young people, and it is really working as a provinces in Afghanistan that the vulnerable population might be reached, and we hope to hear from UNEG maybe in our future sessions. Thank you.
Thanks a lot, Lilia. Carlos, would you like to report?
Yes, thank you, Emilia. So good afternoon, good morning, everyone. I was facilitating the sessions of the group 3. We have in our group colleagues from WFP, from UNICEF, from USAID, from FAO, as well as from the Office of the United Nations High Commissioner for Human Rights. So let me just mention 3 takeaways that kind of summarize a little bit the sharing of experience, because each of us were able to share some of our experiences trying to reach vulnerable groups. So one member of the group highlighted that for his organization, it was really very difficult to reach any group, not any specific vulnerable group, but in general, it was the way of the traditional way of doing evaluations. I mean, it was affected because of the restrictions to travel to the countries, and also to move around in the countries that often happen in several of the countries in the global south. There was well, as a result of that, I mean, colleagues shared experiences from UNICEF, from USAID, whereby the agencies tried to reach out different types of vulnerable groups using digital means, or what I think we heard today in some of the presentations, low and low-cost technologies, the using of mobile phones, the using of radio. Those were 2 of the tools that were very popular in trying to reach out to specific groups. And the importance of digitalization, I think, if the pandemic did something, was to highlight the importance of digitalizing the way we conduct evaluations. And moving forward, there is a need to continue to strengthen the methods, to continue learning from the methods we use, we innovated, but also to strengthen the networks we develop, because to conduct this type of digital or remote evaluations, we actually reach out to people with whom we would not have worked unless there was this pandemic, And some of those partnerships require also strengthening. And I just remember Uyen mentioning quite a few in her presentation from Statistics Without Borders. Who would have thought that there was something like that? I learned first time thanks to Uyen. No, so let me stop here, and thank you very much again, everyone, for sharing your experiences.
Thanks, Carlos. Thanks a lot. Mona, would you like to report now your group? Thanks.
So in our group, Seema was the rapporteur. So
Yes.
over to Seema. Thank you.
Yeah, thank you. So first of all, the field presence of staff was key to be able to reach beneficiaries during the pandemic. Having people in the field, country offices or around camps, etc., was very helpful. The second point is the importance of determining the purpose of the data collection. So asking key questions: do we really need this data? Do we really want to monitor this project? And this pandemic brought up some ethical questions about monitoring that weren't raised before. The third point is about phone surveys. So our colleague highlighted the importance of getting more than one contact details from beneficiaries to make sure that they could be reached. So it was a phone number, Facebook, etc. So in case a phone number changes. And in addition to this point, it was the phone incentives apparently were very effective to make sure that we reach out to all beneficiaries and that they participate in surveys. And then another point that was raised about common problems of UNICEF being able to access money from multilateral banks. And some governments were on board and proactive. However, some other governments weren't able to outreach. These were lessons learned that came out from a real-time evaluation. And if I missed a point, please, you can add on.
Thanks a lot.
I have a question. Seema, you mentioned ethical questions with monitoring. Anyone in particular your group was referring to? Yes, someone referred to this.
I can quickly come in on that one. I think that might be referring to the example I'd given. I talked about the joint program between UNICEF and UNFPA to eliminate FGM, and we had an evaluation of the third phase of that program that took place during the pandemic, and it was fully remote. But we didn't want to neglect getting community members' views, but we could not, because of the nature of the topic, because we couldn't travel and do any sort of face-to-face data collection. We couldn't really ask program participants specifically about their experiences. So we used UReport, which is a mobile phone polling platform, just to obtain general community perspectives and attitudes about the practice rather than actual community participants in the program, and went through an ethical review process to do so.
Thanks a lot, Seema and Mona. Now for the Elisabetta.
Good. Let me share the screen here. So first, I think it's also useful as a conclusion. There is a wealth of information across partners now, what we learned from the epidemic, how to summarize it and share the key learnings. This webinar is one example, but I think we need to do more to really use what has been learned. Then one example was mentioned from FAO in Sri Lanka, a WhatsApp group, but we want to know more about it. So it's open for FAO colleagues in the call. For WFP, cash transfer was a way to reach the most vulnerable at distribution points with telephone, etc. And the distribution points, in fact, were a good opportunity to collect information. For instance, in Afghanistan, since it was one of the few ways to reach women that could go out because of this program. So that was mentioned as another example. Then somebody from UNICEF was also was a bit less optimistic and positive, and saying that they tried to work with NGO to reach the most vulnerable, but it's still very challenging, not just to reach them, but to even identify who they are in certain communities. So there remain a lot of knowledge gaps in terms of the impact of COVID on those populations. And technology might be an issue, a solution, but it's not the miracle solution in all contexts. For instance, in a household, who really owns the telephone? And there are questions linked to it. So good about technology, but more to be considered. And then an interesting point that came out is the correlation between reaching the most vulnerable, not just with evaluation, but with programs. So the two are correlated and linked. And good programmatic partnerships are needed if we want successful evaluation. We cannot just speak about evaluation in isolation. Another example, this is from UNAIDS, the agency I work for, that really allows us to reach the most vulnerable in evaluation, is working with the networks that represent those populations, for instance, sex workers in our case. But we can do it and easily and well because there are already very good programmatic partnerships with them. So we just leverage those partnerships. We don't create them from scratch through evaluation. And a last point from Jerusha, I remember, is that it's very important, the trust from the community, if we want to engage them. So to create that trust, one way is to link with somebody that has that power in the community, the power to open up to others. She explained in the presentation, but we were lucky enough to have her in the group to have more detail. And the fact that we use virtual platform really allows to collaborate in a faster and quicker way. Thank you.
Thanks a lot, Elisabetta. Thanks a lot to all the moderators and participants of the groups. I actually have a question. So we have like a few minutes for additional questions and discussions. I had a question. I'm trying to find out where my question is. But if anyone else has a question, please raise your hand or open your microphone.
Hi, I don't have so much a question, but I was really happy to hear the feedback in the breakout room about collecting from this particular subpopulation. And I perhaps didn't mention it in my presentation, but we are doing this iteration of this community rapid assessment through mobile phones, and we are including a subpopulation demographic variable in this module, such as are you an IDP or are you a refugee? Are you and there are specific ones that the Afghanistan country office wanted to see if we could find that. So that is not a perfect way because we're not sure how many respondents we'll get from that group. And I think Lilia mentioned it earlier, there are other crowdsourcing enumeration vehicles that send people to specific settlements to collect data. And I think that's one that we'd like to explore with in certain humanitarian situations. For Afghanistan, we've noticed the country has put a ban on monitoring data, even the mix. So we're seeing that remote data collection methods will be possibly more in demand because the complications in certain countries will make it more complicated to collect data. But I just wanted to mention that there is a way to sort of put a demographic variable subpopulation inside the phone, and if there's something to be learned, I'd be sure to share it with this group.
Thank you, Uyen. I have a question for you, and also a question for the person in the group of Mona that spoke about the phone surveys and phone incentives. So my question is first about the phone incentives. Were these what was that like a little bit of credit that you gave to people so that they would respond to the like if they responded the survey they got the credit? And and to Uyen, my question is how did you get the university to work pro bono with you? Because was it connected with their research, with some research that they were doing? Because I think this can be very interesting way of getting a very good quality partnership. So these are my questions. Thank you.
Yeah, hi. Yeah. So what we did, we worked with a company that enabled us to transfer money via the phone. So and this worked in almost all of the countries. So we were working in 12 countries in Asia, Africa, and Eastern Europe. And there they offered a service. It was at times pretty costly, to be honest. In other countries, it was very cheap to transfer the money. And there we actually we had a register. So as said before, it was the second phase of a panel of returnees, and the first one was physical in the field missions at IOM, the first survey, and then the second one we had to move to this mobile to the mobile surveys, and so after that we had our surveys were conducted by colleagues from field offices to be able to speak the language and so on. And then as soon as a survey was completed at the end, then we had a list of completed surveys, sent this to the company to transfer the money. So this was basically how it worked.
Yeah, I mean, airtime incentives, that's what we're doing now, because as Martin said, this is what we can really push our response rate. So we're doing that for a little bit, and the incremental investment on this yields a quite high return on investment. So that was a lesson learned. We didn't do it for the first round, but then when we really needed to boost the sample size, we did it. For universities, I mean, they're very keen on trying new stuff and doing it in a way that has some scientific soundness, right? So when I had conceptualized it, I'd written like the paper on pitching it, and I just reached out to a few universities, but I went back to Harvard because I knew that Harvard Humanitarian Initiative is very keen on this kind of new remote data and harnessing digital technologies. And, if you do something quite rigorous, they're always going to help. And they did it just with under an MOU that we would share our data. And if we share data that they can publish, that's their currency, right? Publication. So it's a quite good, arrangement. I guess I got lucky. I don't know.
Thanks a lot,
Sure.
Yen. Okay, thanks a lot, everyone. Over to Lilia now for the wrap up. Thank you.
Thank you for all your contributions. Of course, the pandemic challenged the ways we work and made us really think of new and innovative and cost-effective methods. We tried to make our evaluations gender and human rights responsive, but we could not always reach the most vulnerable. And this was probably one of the major lessons learned from the pandemic. And this was also the main thought to have this session, to share these experiences and to learn from all of you. We are very grateful to our amazing keynote speakers, to everyone who helped us conceptualize this session, and to all our participants. And please share with us any other examples that you could probably not share during this session. We will share our emails, and we wish you all a very happy new year and stay safe and healthy. Thank you so much again.